Professor Prof Kardas is the founding director of the Medication Adherence Research Center and head of Department of Family Medicine at the Medical University of Lodz in Poland. Professor, could you tell us a bit more about yourself and when you started your research in the area of medication adherence?
Counting the years that I devoted to medication adherence, I can guess I'm a very old one because it's nearly 25 years now. And I guess over that time I have seen a lot of mistakes of patients who, for different reasons, either do not want to or are not able to follow their doctor's advices.
So, as you mentioned, your professional activities primarily revolve around patient adherence to medication. Could you elaborate on how this area intersects with other aspects of healthcare and highlight its significance in improving patient outcomes?
So at first you need to understand that non-adherence is something which happens very frequently. In fact, in 50% of patients we do have some problems with execution of long-term therapies. So it's not a rare question, just the contrary, is a sort of daily happenings. And with this in mind, you can understand why it affects very hardly the outcomes at first, but when you consider this, you won't be surprised that it has further consequences. These consequences involve increased use of the medical services. These patients who deteriorate are also hospitalized very often, which costs a lot. Altogether, non-adherence is adding much to the overall cost of the healthcare system. Finally, the consequences of this might be the serious ones, I mean the deaths. A lot of people die because of non-adherence. Die much sooner, of course, than they could if they follow the advice. But there is also another perspective, very important perspective of non-adherence, because when the drugs are used in imperfect way, our investments in the health of these people is wasted. So we lose a lot of money, and overall, not only the pharmacists earn less and the pharma industry sells less of the drug, but as the whole society, we are losing a lot.
Yeah, sure, I understand that. Okay, in 2020, you founded the Medication Adherence Research Center. Could you explain the motivation behind establishing this center and outline its main activities and challenges? You told me a lot about the challenges about medication adherence just right now, so a bit about its main activities and the base behind that center.
After years of working in this area, me, myself, as well as my team, decided to frame this under the label of the specific center. At the time, we believed that we were one of many. In fact, looking at the moment at the area of medication adherence across Europe, we found out that our center was only second in Europe, and in fact the first one in Central and East Europe. What we do in this center is to approach medication adherence from different angles, so we try to help this at first at the individual patient level, but our idea is also to conduct research devoted to adherence in order to find out the most effective approaches toward helping this sort of people, but also helping healthcare professionals, these being doctors, these being nurses, these being pharmacists, and many more, who, being faced with medication adherence, have plenty of new tasks and a lot of problems. Along with these, we devote our activities to didactics, so we provide the education to the new generations of healthcare professionals, and we stimulate international collaboration. Out of this center, idea of collaboration of that sort, of creating centers, came to the international area, and currently at the platform of the Enable collaboration, which is a European collaboration of researchers active in this very field, we are discussing how to promote the emergence of similar centers in the other countries.
Okay, I think I shall move on to the GATEKEEPER project. Earlier this year, the University of Lodz, in collaboration with the Center for Health Technology Assessment and Pharmacoeconomic Research, so our research group at University of Pécs, was awarded a research grant from the GATEKEEPER Twinning project. The goal of this project is to adapt the medication adherence coaching application developed by your team at University of Lodz. Can you provide some insights into the initial development of this application and outline your team's objectives?
First of all, let me tell you about GATEKEEPER. GATEKEEPER is a huge international project covering in practical terms all the Europe, devoted to e-health, electronic health, digital health maybe. And with this in mind, it looks at different angles, but one of these is medication adherence. Within this very project, we try to help those who need to conduct their daily, who need to execute their daily treatment for multiple chronic conditions with a support, because often these people being left alone face different problems. So for that very reason, we have elaborated the dedicated application, an application which in fact helps these people to identify the major problems and coaches them how to overcome these problems. We try to find out the easy to implement and realistic solutions to their problems and provide this to the patients in order to help them to be better and more systematic in their drug taking.
Yeah, okay, thank you. Moving on to my last question. Looking ahead, how do you see the future collaboration opportunities between the Medical University of Lodz and University of Pécs? Are there any specific areas for collaboration you would like to explore in the future?
You kindly mentioned GATEKEEPER project, and this is exactly what brought us here for the meeting with the colleagues from the Pécs University, who will be looking at the application that we created in Poland in more data, because we managed to translate it together and adapt it to the Hungarian scenario. Now it will be employed in Hungary and assessed in both clinical way as well as pharmacoeconomical way. So we will gain from you the information of how well it performs also in terms of money and the savings that it provides. Starting with these, we look forward toward the other collaborations that we may go for. Multiple projects are in our minds. So we are aiming very high, but the collaboration which has been already established in between our teams at the platform of Enable, which ended up with a number of common publications so far, which stimulated the international meeting of Enable, SPACAMP association devoted to medication adherence, to come exactly to Hungary this fall. In November 2023, it will be organized in Budapest, is proving that we are going very good direction.